Navim, working as emergency department, Chowdhury Hospital, Dhaka, and fellow of the Royal School for Public Health, UK. Today, I want to go through my topic, that is the current factor specifically for the current medicine in the UK. My topic is genetic influence of the urinary infection, progression and prevention of the modern disease. The background is that modern disease are one of the most widely non-communicable disease nowadays. Recent statistical evidence show that the mortality for the disease with the 2004. Besides some visible comorbidities, long-standing urinary infection and genetic disposition become significant for its rapid prevalence. So, preventive perspective should be gradually highlighted. Prevalence of UTI induced chronic kidney disease. Near about 10% people around the world suffer from the urinary infection that turns into chronic kidney disease. Particularly, UTIs are considered that approximately 40% of women and 5% of the men will have at least one episode during their lifetime. One cross-sectional study was 2021 among thousands of people. Prevalence of UTI on women was 61.8% with significant asymptomatic UTI for the 28%. Cause of high prevalence of UTI in women, we know, is one of the common cause for high prevalence in the women in UTI is the structure of urethra. So first we want to difference the UTI of male and female urethra. Into the male side is the penetrating center and into the female it is fourth center. So it is one of the final cause for the high prevalence in case of women. Commonly function of male is urination ejaculation and in case of female is only the urination. And for the graph, because of male is first circulation in kidney and here is straight, and one of the cause for high prevalence of the in case of female. Cause of high UTI prevalence on women and common cause like pregnancy. Working facilities, especially because the working women are not well facilitated in most of the working places. We know in case of RMD sectors and others in case of different working place, there is no toilet is not well facilitated for the women. So they are not easily habituated for the regular voiding. Is one of the important cause for the high prevalence of UTI in women in our country. Lack of awareness of the hygiene intercourse among men and women is one of the vital cause. We know overwhelming tendency in UTI induced symptoms. Because patients because of our country women are not so much conscious of aware of taking the pure drinking water, and they think they are not aware of symptoms like fever, low fever, things like that, and sometimes we diagnose it for the late stage. Genetic infection retail because it is the vital cause for the topic. Genes are always the expression of all the receptors. T are the utmost importance as T and R have the key role in the production of the uroepithelium in the immune pathogens by activating the innate immune response. As the pathogen manages to enter the interact, T and R supervise the pathogen associated molecular patterns and then lead to the cascade of inflammatory response in order to eliminate the intruder. Our objective: determine the prevalence of the UTI induced chronic kidney disease, genetic prevalence of the UTI for the sticky reproduction, and preventive awareness its ultimate effect. Expansion of the institutional study on genetic influence of the UTI for early screening and prevention of the CKD. Methodology: duration of the study February 2023 to August 2023. Location of the study humanity and OPD of the Medicine and Nephrology Department of the Chowdhury Hospital. Number of participants 75. Cause is high prevalence among female patients. 44 are married patients and third one is unmarried. Age range of the participants 35 to 47. This one is for 2 years and is the first session of studies. Inclusion factors: following genetic history of the UTI for the CKD, typical and atypical UTI and CKD related features is 1 more than 1 year. Then work history, intercourse related any physical and work history with proper confidentiality. And excluding factors are cause comorbidities like the progress CV like diabetes, hypertension, dyslipidemia, and structural or any neurological abnormalities. Serum creatinine with EGFR, urine RNA routine diagnostic examination, complete blood picture, and other investigation given for the further study and follow-up after 1 month. Now we see the prevalence of the different causes of UTI. Genetic is 47%, pregnancy 21%, late voiding is 30%, genetic and combination of the late voiding is 39%, and unhygienic intercourse is high prevalence of 10%. In this chart, we will see that the prevalence of PD in range is prevalence. In case of 8 to 3.5 mg per deciliter is 45%, in case of 4 to 6.5 mg per deciliter is 35%, and 6.5 or greater the range is 20%. So the wider range there. This is the result of creating range which corresponding to RNA. In the genetic is range is 4.6 to 2.3 mg per deciliter. In the here is the RNA is the range of papa series 7 to 10 is correct. Late voiding is 2 to 3.5 mg per deciliter, and past series 10 to 12 inch per HPF. In the beginning, late voiding is 3.5 to 6 mg per deciliter, and past series 20 per HPF. In the pregnancy is 1.4 to 1.9, and in RNA we see the past series 10 to 15 per HPF, and with unhygienic intercourse pattern 1.2 to 1.3 mg per deciliter, and we see the urine RNA in past series 5 to 9 per HPF. And next, after 6 months follow-up, the reduction of the creatinine, genetic and late voiding is 36%, in the genetic range, genetic cause for 22%, pregnancy 5%, unhygienic intercourse is 10%, and late voiding creatinine is 27%. My recommendations: early genetic screening is very much important for primary prevention. Awareness increasing program for detecting mutate symptoms. Emphasis on creatinine, urine RNA, urine culture sensitivity tests, and subsequent tests on community level, 6 months to 1 year basis. Sufficient dedicated public tolerance for working women and fashion-by women should be established in case of government and non-government participation. Health education program on community level should be emphasized. The rate of decreasing of creatinine is positive family history based UK. It has so much satisfactory in our country. Its medical prevention based upon early voiding habit. Screening of positive family history may be helpful to slow the rate of prevention of chronic kidney disease. I want to